Hi, my name is Bethany Yeiser. I'm here today with the Cures Foundation board member and my former doctor, Henry Nasrallah. And I just wanted to say, when I was diagnosed with schizophrenia in 2007, I didn't know anything was wrong with me. I remember I got on medication, the visual hallucinations went away, the delusions went away, the paranoia went away. I was doing so much better. And I did not have a clue that that medication helped me at all. So I did what the vast majority of patients do. When the side effects showed up, I was done. I got rid of my antipsychotic medication. I didn't realize how dangerous it was.
Now you do, but back then you didn't.
Now I do.
Yes.
What I know today is that having a psychotic episode is like having a brain attack. If you have a heart attack, what do? If you have a heart attack, you go to your doctor, you change your diet, you may exercise, you take medication, you do whatever it takes to not have another heart attack. And with psychotic episodes, with brain attacks, they do, in fact, damage the tissue of your brain.
Yes. Heart attacks destroy part of the heart, and the psychosis, brain attack, destroys part of the brain.
Yes.
That's why they are similar.
I didn't know that the most important thing for me to have a recovered, productive life was to work with that doctor. And I also wish he had said, Bethany, you may have some side effects.
Yeah.
And if you do have side effects, get in touch with me. Do not just take the medication and flush it down the toilet.
Right. And many patients do that. And we have to educate them in advance. Like, there are some side effects, but they will go away. And it's a sign
Or
that
they're treatable.
It's treatable, yeah. Just let us know, like you said. And what you say, Bethany, is so important from the patient's point of view. You wish you knew that psychosis is a brain attack, like a heart attack. Psychiatrists should also think of it that way.
And educate their patients
yes,
about that.
And I always tell my colleagues in psychiatry, you should behave like a cardiologist. When a patient develops the first episode of psychosis, regard it like a first heart attack.
Yeah.
What do cardiologists do? They do everything in their power. Never, ever let this patient have a second heart attack, because it'll destroy more muscles of the heart and the patient may die.
Yeah.
Same thing with psychiatry. We should never, ever let our patients have another psychotic relapse, which happens all the time because patients stop their medication.
And it's absolutely imperative for doctors to do a better job when they're releasing their patients. Tell them about the dangers going off the med. Make them aware that these are not like trials of antibiotics, where you can take them for a week or two, stop for 3 years, and take them again. You know, these medications can be less effective every time they're restarted.
Yeah, that's true. And I tell my patients that it's like diabetes, like high blood pressure. You should take this medication ongoing. Don't just stop them. It's not an antibiotic for 10 days.
Yeah.
But many patients don't realize it, and they don't think they're sick. That's the problem.
Yeah, I wish I could go back in time and understand the risks of stopping my medication. And today in my work and in yours as well, you know, it's so important to talk about adherence. And another important topic is long-acting injectables, which have proven remarkably effective.
Well, let's talk about them. I mean, long-acting injectables are lifesavers for patients with schizophrenia, because they do stop the medications, like you said. The adherence, staying with the medicine, is so poor because first they don't think they're sick. We call it
I didn't.
You didn't. Many patients, 90% of patients who have the first psychotic episodes,
The vast majority.
we have to drag them into the hospital against their will. The state allows us to put them in the hospital involuntarily because they refuse to get treatment. I'm not sick, nothing wrong with me. Meanwhile, they're delusional, paranoid, hallucinating, but they have no insight.
I was living outside in a churchyard, delusional and hallucinating every day, and I thought I was a picture of mental health.
But that's why they don't take their medication, because they don't believe they're sick. Second, they also forget. There's memory problem, as I mentioned, about cognition in schizophrenia. They forget. Then there's the negative symptoms like apathy, lack of motivation. They don't want to reach out and take pills. And then they are also taking drugs, Bethany. We talked about drug abuse and marijuana and alcohol.
Very common comorbidity.
It's impossible to take a prescription drug when you are stoned and drunk. It doesn't happen. So our patients are doomed to relapse. And that is the tragedy of schizophrenia.
We must do better.
Yes, we must do better and never let them have another brain attack. This is where long-acting injectables come in. They are really lifesavers because it's the only way we can make sure, I do it with my patient, the only way I know that the medication given in the muscle for a whole month. It works without pills, slowly going into the blood and protecting the patient. Sometimes they're available in every 2 months, every 3 months. Different companies make different long-acting injectables, and the latest one is once every 6 months.
Yes.
I mean, it's like science fiction to me. When I was training as a psychiatrist, 30 years ago, if somebody told me you can treat schizophrenia with 1 injection every 6 months and no pills, I would say, get out of here, that's science fiction. It's true. We can do that for our patients because they cannot take the pills. They destroy themselves, destroy their brain. So I'm really pleased that we have long-acting injectables, but you know what's the tragedy is? They're underutilized. Just like clozapine is very underutilized, long-acting injectable, many clinicians are not using them until the patient's already a basket case, have become totally hopeless, and then they say, maybe I should use long-acting. But in the meantime, it's like having multiple heart attacks. It's very hard to, the heart will fail and the patient may die with multiple heart attacks. Patients with multiple psychotic episodes will have brain damage and they become homeless, hopelessly sick. And that's too late to use long-acting. They should be used early. Yeah.
Excellent. Well,
But thanks for talking about this important topic, and I hope our listeners or viewers realize that schizophrenia is treatable, and there are medications that work very well for it. Clozapine for the treatment resistant, and long-acting for those who refuse to take their medication.